Electrical stimulation uses electrical pulses to mimic the action of signals coming from neurons. These mild electrical currents target either muscles or nerves. There are some different types of electrical stimulation, and all of them play different roles with what they work and how they work. The first type is neuromuscular electrical stimulation, or NMES for short. In sports medicine, neuromuscular electrical stimulation has been used for muscle strengthening, maintenance of muscle mass, and strengthening during prolonged periods of immobilization. Along with this, selective muscle retraining. NMES uses high-intensity electrical stimulation to elicit intermittent contraction and relaxation of proximal muscle fibers. Clinical NMES systems stimulate either the nerve directly or the motor point of the nerve proximal to the neuromuscular junction. Most clinical NMES systems fall into two broad categories. They are surface and implanted. These systems are either voltage or current regulated. A case I researched recently called the neuromuscular electrical stimulation for quadriceps muscle strengthening after bilateral total knee arthroplasty, goes into details of how exactly the intervention could be used as a modality. It was pretty much for, like it says, they did the stimulation on older patients that had just had a bilateral knee arthroplasty, which was obviously bilateral is both of them, both knees. In the study, 5 of the patients participated in a voluntary exercise program for both knees, and MES, for the weaker knee. And then 3 patients participated in a voluntary exercise program for both knees without the NMES. For each treatment session, 10 isometric electrically elicited muscle contractions were administered at maximally tolerated doses to the initially weaker leg of the NMES group. Quadriceps strength and muscle activation were repeatedly assessed up to 6 months after surgery using burst techniques. At the end of the study, the results showed that the experiment was successful and it was a useful intervention. The weak NMES treated legs of 4 of the 5 patients in MES groups had surpassed the strength of the contralateral leg. In contrast, none of the weak legs in the exercise group were stronger than the contralateral leg at 6 months. Changes in quadricep muscle activation mirrored the changes exhibited in strength. This pretty much showed that the study was beneficial. It was effective, and that the NMES modality is something that could be used as opposed to other techniques. Interferential current therapy is a somewhat effective therapy option used by many physiotherapy clinics to relieve pain and accelerate the self-healing process. Getting your body back to a healthy and pain-free state is the most important part, and that's what this is targeted to do. The high-frequency signals of an IFC penetrate through the skin into deeper lying muscle tissues. The IFC device then transmits electrical impulses in minute quantities through your skin. Underlying tissue and nerves are stimulated, which begins the healing properties and process. IFC is very useful in the treatment of circulatory and muscular disorders, stiffness of joints, edema, and inflammation. A case study done called IFC therapy in patients with knee osteoarthritis showed that these results may not be as great as previously thought. The study was randomized and single-blind, performed on 60 patients diagnosed with osteoarthritis. The patients were allocated to 3 active IFC groups, 40 hertz, 100 hertz, and 180 hertz. Each of these groups was split evenly and randomized. And then there was also one placebo IFC group. The treatments were performed 5 times a week for 3 weeks consecutively, and the results showed that all of the groups showed progress from where they were and somewhat of effectiveness, even that of the placebo group, even though the IFC groups were slightly better. But there lies that possibility of better options being out there instead. In summary, IFC can be a useful form of electric stimulation, but there may be other stimulations that could be a better option. But it is also it is still is beneficial in ways. HVPC, or high voltage electrical stimulation, is a type of electrical stimulation that may be used to decrease pain or improve circulation. It is also occasionally used to help with wound healing. It is thought that the high voltage stimulation helps change the type of cells near the wound, and this can speed up healing. This stimulation modality employs monophasic pulsed current. Pulse is being delivered in a doublet. Each pulse is short duration, but as the name implies, at a high peak voltage. Um, the case study I was able to come across, called The Effect of High Voltage Pulsed Current Plus Conventional Treatment on Acute Ankle Sprain, is obviously exactly what it sounds like. The study was done on patients experiencing ankle sprains. It was randomized, controlled, double-blind clinical trial with 3 intervention groups. There was a control group. This was, just the obviously what a control group is. And there was HVPC negative group, treatment, conventional treatment plus negative polarity. And then there was also HVPC positive group, which was the opposite, with a positive polarity, obviously, with still conventional treatment added onto that. The study was done with 28 participants that had acute ankle sprains. It was a conventional treatment, consisted of cryotherapy, which so every group received cryotherapy, but the 2 positive and negative groups received obviously the HVPC on top of that. So everyone reached it was 20 minutes plus the therapeutic exercises. The other groups received 30 minutes each of electrical stimulation, whether that was the positive or the negative. Pain, edema, range of motion, and gait were assessed before the first treatment session and then after the last treatment session, and the results were tallied from that. The results showed that there was no significant difference in the groups. Most of them finished out really the same thing, whether it was the control group or whatever it might be. There was no significant difference between that. There was better range of motion and less pain, edema, that kind of thing, but not necessarily due to the negative or positive polarity of the high voltage charges current. So it showed that it may not be an incredibly effective form of electrical stimulation. So iontophoresis is a technique which uses an electrical current to deliver a medicine or other chemical through the skin. It is sometimes called an injection without the needle. Iontophoresis is most commonly used to treat hyperhidrosis disorder, a condition that results in persistent and excessive sweating. This sweating may occur in certain situations, such as during warm weather, physical activity, or without any trigger at all. It can also be caused by other medical conditions, such as hyperthyroidism or menopause. I chose a case study called Mobilization with Movement as an Adjunct Intervention in a Patient with Complicated Tenosynovitis. The study was done on a 61-year-old who presented signs and symptoms consistent with tenosynovitis on the right hand and wrist. Range limitations in all motions of the right wrist were the case. The treatment was an intervention with superficial heat, ice, iontophoresis, and transverse friction massage directed to the first dorsal tunnel. Conventional joint mobilization techniques address the motion limitations on the first carpo-metacarpal, radiocarpal, and midcarpal joints. The treatment resulted in a total resolution of the patient's impairments and was completely solved. This concluding that iontophoresis could be potentially used as an effective source or intervention of modality. Transcutaneous electrical nerve stimulation, or TENS, is currently one of the most commonly used forms of electrical stimulation. Hundreds of clinical reports exist concerning the use of TENS for various types of conditions, such as low back pain, arthritic pain, sympathetically mediated pain, bladder incontinence, neurogenic pain, visceral pain, and post-surgical pain. The way it works is the electrical currents block the pain receptors from being sent from the nerves to the brain. And then these same electrical impulses are also stimulated in the body to produce unnatural pain relievers of endorphins. So it's essentially a two-part thing where it's taking the pain and blocking it and not letting it get to the brain and tell the body that it's hurting, but also sending out endorphins and making things feel better. A research study found called the electrocortical analysis of patients with intercostobrachial pain treated with TENS after breast cancer surgery was one that told of the effectiveness of TENS as an electrical stimulation. A randomized clinical study was conducted of breast cancer patients who had pain syndrome due to intercostal brachial nerve injury. 18 patients with a mean age of 54.38 years old were studied. Eligible participants were randomly distributed to Group A, TENS acupuncture, or Group B, which was TENS burst. At the time of the TENS application, the patients were blind regarding the treatment group they were in, as well as the procedure to be performed. EEG subjects of both groups were measured at rest and 10 and 15 minutes after the TENS application. They were recorded simultaneously by the TENS application, and then the analysis was carried out at home on the 10th minute during the application of TENS. The study stated after the EEG analysis showed there was a decrease in slow and fast alpha absolute power in both groups in all of the electrodes. The study concluded that the results show there was a decrease in pain sensation in both groups, thus telling that TENS could be a useful application to different types of pain, including that of breast cancer.